The Biden administration has announced that they're going to wind down the emergency measures that were put in place at the start of the pandemic, and that will restructure how the federal government is going to respond to the pandemic, which is about to enter its fourth year. We still are seeing a lot of deaths from COVID. It's still up there among the leading causes of death, but the real emergency aspect of the pandemic has passed, and there's a lot of pressure from Republicans to end these special measures. And in fact, the House is going to be voting on resolutions to end that immediately. And so the White House tried to preempt those votes by announcing the emergencies will end on May 11th. And they said that you have an abrupt end that would create, quote, wide-ranging chaos and uncertainty throughout the healthcare system. One of the biggest things that it did was it gave states extra money for Medicaid, and the federal government gave the states more money for that in exchange for states not kicking people off Medicaid during the emergency. So that is going to end starting in May. The states will start eliminating people from the rolls who no longer qualify for Medicaid. Hospitals and nursing homes were given extra flexibilities that had to do with staffing and billing procedures, and that will end when the emergencies end, and they'll need some time to adjust to that. The cost of vaccines is expected to go up. How an individual person will be affected by costs will vary. Those who will be in the most trouble are people who don't have insurance. They may not have any way to get the vaccines or the tests or the treatment. For people who have private insurance, that may depend on how good your insurance is.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.